Right now, about half the adults in this country are walking around with high blood pressure. Most of them feel completely fine. And in the largest analysis of exercise and blood pressure ever run, 270 trials, almost 16,000 people, the winner was not running. It was not cycling. It was not lifting weights. It was standing still against a wall. Let me show you the numbers. If you have been with us, you know lever 1 was movement, and lever 2 was food. This is lever 3, and it is the quiet one. In the next few minutes, what high pressure is actually doing to your arteries while you feel nothing. The habit that topped the leaderboard, why researchers think it works, and exactly how to do it in under half an hour a week. Chapter 1. The damage you cannot feel. High blood pressure earned the name the silent killer, honestly. There are no symptoms to notice, no pain to report. The only way to know is to measure. And the numbers on how many people are missing it are worse than most people expect. Here's the American picture from the Centers for Disease Control, measured between 2021 and 2023. 47.7% of adults have high blood pressure, nearly half. Of those, about 4 in 10 do not know they have it, and of everyone with a diagnosis, only 20.7% have it controlled to the target. That is roughly 1 in 5. These are population numbers, associations in the cited surveys, not a prediction about you. So what is the pressure actually doing? Think of your arteries as living, flexible tubes. Every heartbeat sends a pressure wave through them. When that wave is too strong for years, it mechanically stresses the inner lining, a single layer of cells called the endothelium. A healthy endothelium releases nitric oxide, the molecule that tells the vessel to relax. Damaged, it releases less, so the vessel relaxes less, and the pressure climbs a little more. Then the wall itself rebuilds. Under chronic pressure, arteries lay down more collagen, the stiff structural protein, and break down elastin, the springy one. A flexible tube slowly becomes a rigid pipe, and a rigid pipe cannot cushion the next heartbeat, so the peak pressure goes higher still. Your heart now has to push against that stiffness every second, and the muscle of the left ventricle thickens in response. Cardiologists call it left ventricular hypertrophy. That is why the number itself matters so much. A landmark analysis in The Lancet in 2016 pooled 123 studies and more than 600,000 people. For every 10-point drop in the top number, the systolic, they measured about 20% fewer major cardiovascular events, 27% fewer strokes, 28% less heart failure, and 13% lower risk of death from any cause. Important caveat, those are averages across trial populations, an association in the cited studies, not a guaranteed personal outcome. And most of those trials lowered pressure with medication. Chapter 2. The habit. In July 2023, the British Journal of Sports Medicine published the biggest head-to-head comparison of exercise and blood pressure that has ever been done, and it quietly upended the standard advice. The researchers pulled together 270 randomized controlled trials run between 1990 and early 2023, covering 50,127 people. Then they ranked 5 kinds of exercise against each other: aerobic training, dynamic resistance training, the two combined, high-intensity interval training, and isometric exercise. Isometric means you hold a position under tension. You do not move at all. Here is the leaderboard, in millimeters of mercury dropped from resting systolic pressure. High-intensity intervals, 4.08. Aerobic exercise, the running and cycling everyone recommends, 4.49. Dynamic resistance training, the weights, 4.55. Combining aerobic and weights, 6.04. And isometric exercise, 8.24. On the statistical ranking the authors used, isometric training came out on top with a score of 98 out of 100. Nothing else was close. And when they drilled into the specific movements, one came out first for lowering the top number: the wall squat. Back flat against a wall, knees bent, thighs taking the load, holding, no gym, no equipment, no weight to buy. Interestingly, in the same analysis, running still came out first for the bottom number, the diastolic. So this is not a story about running being wrong, it is a story about a missing tool. Now the honest part, because you deserve it. This analysis measured blood pressure, the number. It did not follow people for years to count heart attacks and strokes. Aerobic exercise still carries the deepest long-term outcome evidence. and the 2025 American Heart Association and American College of Cardiology guideline recommends aerobic and resistance training. It does not name isometric training yet. The researchers argue their results should inform future guidelines. That is a proposal, not current guidance. Treat wall squats as an addition to what already works, not a replacement. So, a number that damages you silently, and a habit that asks you to stand perfectly still. Let us talk about why that could possibly work. Chapter 3. Why it works. And here I have to be careful with my words because the mechanism is still being worked out. What follows is the leading explanation researchers have proposed, not settled fact. When you hold a wall squat, your thigh muscles stay contracted and a contracted muscle squeezes the blood vessels running through it. Flow through those vessels drops. Pressure and heart rate rise during the hold, which is exactly why intensity matters and why we will get to safety before technique. Then you stand up and the squeeze releases. Blood rushes back through vessels that were just clamped shut. Researchers think that surge drags along the vessel wall, a force called shear stress. And that shear signals the endothelium to make more nitric oxide, the same relaxing molecule that high pressure was destroying. Do that repeatedly, and the theory is that resting vessel tone comes down, so resting pressure comes down with it. There's a second proposed piece, the nervous system. Studies of isometric training also report improved balance between the accelerator and brake sides of your autonomic nervous system and better baroreflex sensitivity, the reflex that corrects your pressure moment to moment. Again, proposed, not proven. But the direction of the evidence is consistent. Chapter 4. Stack it. A wall squat is one lever. It works best sitting on top of 4 other things that have their own trial evidence, and the first one moves faster than anything else on this list. Sodium. In a crossover trial published in JAMA in December 2023, 213 adults aged 50 to 75 spent 1 week eating high sodium and 1 week eating low sodium. The difference in systolic pressure between the 2 weeks was 8 millimeters of mercury. Compared with their own usual diet, the low sodium week ran about 6 points lower, and roughly 73% of participants dropped. 1 week. Most of the sodium is not in your salt shaker, it is already in packaged bread, sauces, and restaurant food. Diet pattern. The DASH trial, published in the New England Journal of Medicine in 1997, fed 459 adults either a typical American diet or one loaded with fruits, vegetables, and low-fat dairy with less saturated fat. The eating pattern alone lowered systolic pressure by 5.5 points on average. And in the 133 participants who already had hypertension, it dropped 11.4 points. Wait if you are carrying extra. The 2025 guideline puts a number on it that I find genuinely motivating. Roughly 1 millimeter of mercury of blood pressure for every 1 kilogram lost. That is about 1 point for every 2.2 pounds. The target they set is a sustained 5% reduction in body weight, not a transformation. Alcohol. The same guideline is blunt here. The recommended goal is abstinence, or failing that, no more than 1 drink a day for women and 2 for men. Alcohol raises blood pressure directly, and for a lot of people, this is the single fastest change available that nobody wants to hear. And the target itself. The 2025 guideline from the American Heart Association and the American College of Cardiology, published in August of 2025, reaffirms under 130/80 for most adults. On sodium, under 2,300 milligrams a day, with under 1,500 desirable when appropriate. And it now supports potassium-based salt substitutes for selected people, with real caution for anyone with advanced kidney disease. Chapter 5. Your week, here's how to actually run the habit. And we start with safety because holding a position under tension is not for everybody. During an isometric hold, blood flow is restricted and your blood pressure goes up temporarily. That is part of the stimulus. It also means this is not automatically safe for everyone. The safety literature flags 3 situations that need a doctor's review first: unstable angina, uncontrolled stage 2, or higher hypertension, and arrhythmias. Those flags apply to any exercise, not just this one. And one rule for everybody: never hold your breath during the hold. Breathe normally. Holding your breath spikes pressure further. If you are on blood pressure medication, stay on it and talk to your doctor before adding this. Now the protocol straight from the trials. 4 holds, 2 minutes each, 2 minutes of rest in between, 3 sessions a week, with at least a day off between them. That is 8 minutes of actual holding per session, 24 minutes across the week. The consensus paper on delivering this in practice puts typical programs at about 17 minutes a week. Either way, it is less than 1 episode of television. The form. Back flat against a wall, feet about 2 feet out, slide down until your thighs are working hard, but you can hold the position for the full 2 minutes. In the lab, they set the knee angle to hit a target heart rate. At home, use effort. It should feel demanding by the end of the 2 minutes, not agonizing at 30 seconds. If you are shaking at 45 seconds, stand higher. And measure. You cannot manage a number you never look at. Get a validated upper arm cuff, sit still for 5 minutes first, feet flat, back supported, arm at heart level. Take 2 readings a minute apart, morning and evening, and write them down. Bring that log to your doctor. A week of home readings tells a far better story than 1 rushed measurement in a clinic. So that is lever 3. Movement, food, and now the quiet one you do standing still against a wall. Next time we go after the fat you cannot see, the visceral fat wrapped around your organs, why it behaves differently from the fat you can pinch, and what actually shrinks it. Subscribe so you do not miss it, so you do not. Your blood pressure is not a verdict. It is a measurement, taken on one day that responds to what you do on the other days. 4 holds, 2 minutes each, 3 times a week, against a wall you already own. Start this week and let the number tell you what it thinks.